Hi, this is Dr. Jim Anderson, and I'm here today to talk to you a little bit about ankle pain. And I'm talking about ankle pain that's getting pretty severe, because especially as you get older, if you have an active lifestyle, especially if you've sprained your ankles a lot, maybe even had a broken ankle, that can all lead to a damaged joint. You could have ankle arthritis, or you could just have inflammation within the joint. And what I hear from my patients typically is they're very concerned. They're almost afraid to see a doctor sometimes because they're thinking that they may have to look at a fusion of their joint or even a replacement of their joint. And it's very vital you understand you don't have to go to that extent. And I want to talk to you today about scoping your ankle. I found this has been very beneficial to many patients, and it's one of our first steps that you do. In fact, I feel so strongly about it, I feel it could even delay or maybe negate the need for a fusion or replacement of your ankle. And that's why I think it's very important to get the word out about this. For some reason, a lot of patients aren't aware how easily it is to scope an ankle. And so keep that in mind. So why would you scope an ankle? Well, the earlier you do it, the more likely it's going to work. And we have very high success rates with scoping your ankle with very little downtime and very low complication rate. So if you just look at the ankle joint itself, when you twist your ankle, a lot of times what will happen, the cartilage in the joint, particularly on the ankle bone here, can be damaged, and that's what we might find when we go in and scope your ankle. Or it could just be the inner lining of the capsule. All joints have a capsule, and that capsule is sort of tough tissue that holds within it the joint fluid. The inner lining of that capsule has little villi, little finger-like projections, and sometimes those become quite enlarged, and they almost get caught in between here. And when you go in and scope the ankle, basically what we're doing, we make two little incisions on the front. Through one incision we can look inside through the scope, and through the other one we have a little device that kind of goes in. It's like a little garbage disposal. It sucks the fluid out that's going in and kind of bites away at any of the scar tissue that might be in there. These procedures are usually about a half hour, 45 minutes to do. People can usually walk within a few days, and it really gets rid of a lot of your ankle pain. So my point is, I just really want to emphasize it's a very low risk, high benefit procedure, and it's a really good idea to think about doing that earlier than later because it's going to maybe delay or maybe even negate the need for a more severe procedure such as a fusion or ankle replacement. So if you have any questions, please contact us, and maybe we'll be looking forward to seeing you in the near future.